What's up, guys? Welcome to another episode of the Kiss Capids podcast. And today I have a very lovely guest with me today. Let me just let her introduce herself and what she does, and then I'll just, you know the drill. So introduce yourself and tell the people what you have going on.
Hi guys, my name is Ijaba Ahmed. I am currently training at Kenyatta National Hospital. I take pictures on the side, and training
to be because there are people who don't know what Kenyatta is.
I am currently training at Kenyatta National Hospital to become a doctor, and I take pictures on the side as well, and I recently launched a medical relief fund. So yeah.
Wow. That's a lot of serious stuff going on there.
Yeah, I try. I have a lot of jokes on the side as well, but we leave that for later.
Okay. I've just been told, I don't know if this applies to you. We have... What?
I'm not a fan of coconut.
Okay. Yeah, she's good.
Thank you.
Yeah, she's not a fan of coconut. Okay,
Yeah.
That was just an option. So we're going to talk about a little bit of, just from my standpoint, like with just curiosity and everything. Like even like you notice like what my favorite like waiter just said.
Yes.
Like he said like he's never been treated with like a Muslim
By Muslim doctors, true.
before.
Yeah.
And even me too. I've never like I've never come across any
Muslim doctors.
Yeah, but apparently in Kenyatta Hospital, you've said...
Yeah, I feel like we're actually a lot. Like the students,
but I think
faculty.
there's students, faculty.
Yeah, Muslim doctors, Muslim students, Muslim nurses as well.
Yeah,
they're around.
but I think the pattern has been recent, probably in the last 5 years. Before that, I don't think the number was quite...
Yeah.
Was it?
Maybe not as much, because growing up I actually had a non-Muslim doctor. Like I hadn't seen a Muslim doctor as well growing up here.
Oh
in Kenya.
yeah.
Yeah. So I had a Kenyan doctor, the nurses were Kenyan when I was growing up. The doctors were Kenyan. There were very few Muslim doctors at the time, but now I feel like we're a lot.
Like pilots, doctors, and engineers, quite a lot.
Yes, recently I feel like we're coming up.
And women especially, that's something also that I'm guessing like people are not used to.
Yes, actually. Okay, we have people who we have this mentality that...
Oh yes.
Preach. Yeah. Basically, okay, people feel like when they see a lady in a scarf, or rather just a lady, it's like, are you really a doctor?
Yeah.
Are you really, really, really a doctor? You know what I mean?
Doctor?
Yeah,
are you sure?
Yeah. And then I've had this personally done to me. Like you'll be in the hospital,
Yeah.
and then a patient or a patient's relative will come up to you and be like, "Hey, nurse," and I'm like, "Do you assume
immediately?"
Like there's nothing like, "Oh, hi, are you a doctor?" or "Hi, are you a nurse?" Nothing. Like they just assume
immediately.
I don't know if it's because I'm a Muslim or if it's because I'm a lady. They assume that you can't really be a doctor.
Yeah.
So
I'm afraid of being treated with women doctors. I
feel like we're so nice and like gentle.
They are, and that's where the scariest bit is like, I mean, she's too nice. Maybe she's too nice because she doesn't know what she's doing.
Oh, no.
No, but I'm playing. I don't want people to start attacking me like, no,
guys,
I'm just saying.
What you've said.
I'll tell you why. Maybe it's because I don't want to feel weak as a man.
Yeah,
I think that's where it comes in.
Okay, but my question is, what exactly about her being a professional is making you weak? Like, isn't that a problem with you rather than...
It's me, and I know, but, you live and learn, because I'm learning all these different things every single day. And this is me. I'm very like, I'm one of those people who are like, into women's movement, women independence and everything. How about people who are coming from...
Are you a feminist though?
I'm not a feminist.
guys.
Let's not go. Let's not push it. We'll talk about that if you want to.
Okay.
So, like, just tell me a bit of like your background. Like, what, did you grow up trying to be or dreaming of being a doctor, or where did that dream kick in?
Oh, that's a good question.
Yeah. What did you want to be, like, just as a baby?
In my household, rather the African households in general, parents don't really believe in or rather parents back in the day, or rather a few years ago, they never really believed in, I'm going to become like a chef, or I'm going to become like a photographer, or I'm going to become like basically anything that's not like the ideal like professional jobs. You know what I mean?
Yeah.
So, so for me, basically, I did want to become a doctor all my life till a certain point where
you did?
Basically, yeah.
Oh, okay.
Like in my head, I was like, okay, I'm gonna become a doctor. I'm gonna wear like the white coat. It was all about that.
Yeah.
But then towards the end of high school, I was in love with physics, right?
Oh, wow.
And I was considering becoming like an engineer. Okay, but the thing is, ideally, that's like a man's job. You know what I mean?
Yeah, like, I don't know what you mean. I don't know what you mean. I believe in women can do anything they want to be.
Okay. Basically, I was really in love with physics, and I was considering maybe becoming like an engineer.
Yeah.
Because I was like, I like chem, I like math, I like physics. It's like I was meant to become like an engineer.
Yeah.
But I low-key also want to become a doctor. So I was like, Then towards the end of like year 11, I decided, okay, what if I do like medical engineering? And I combined two fields together and do medical engineering.
I don't even know what that is, but
medical engineering.
What's that?
Medical engineering is basically engineering in medicine. Like you make like CT scans, or you design like MRIs.
Okay. Now we're getting warmer because I watch that on TV and series all the time. Yeah. So I mean, it's not far-fetched from what I know. Okay, Okay. So you grew up and you thought that you could combine the two.
Yeah,
and then
I was like, I like medicine and I like physics. Why not like combine the two and become like a medical engineer? But the thing is, not a lot of schools were offering that course because it wasn't really as common as medicine itself or as engineering by itself. Yeah. So then, and the places that were offering were really expensive, like expensive enough to like drill a hole in your pocket or
where
my
did
dad's
you
pocket.
Where did you study first?
I studied in China.
Jeez. you see that's the most interesting thing about it, because like even when I talk to my guests like on Instagram, I just try and like from how I interview people, I just look at their pictures. So at least if you post a few pictures, I'd be like, I'd be interested in a bit of idea of what they're about, because I don't want to come here and just talk like medicine. I just want we can talk about medicine, but everything else that's like influenced like your lifestyle and how you studied, background and all those things. So studying medicine in China. Yeah. Speak Chinese?
Low-key, here and there. Like not fluent, but I get around.
Okay, so you left. Okay, how did you get to go to like just China and study medicine? Because you're saying in Kenya. Did you grow up in Kenya?
For
partly.
Partly.
Okay.
Okay, so basically,
I'll let you tell the story.
Okay, sure.
Yeah.
Sure. So basically, I finished high school, and my brother at the time, my older brother, was already in China. He was doing engineering in China as well. So when I finished, I wanted to become a doctor. Yeah. And the university in Kenya, first of all, they're known for striking. Yeah. Right? Yeah. The lecturers strike, the doctors strike, the nurses strike. So then that puts like a hold on the medical students. And that's not fair for them because they didn't ask for strikes.
Yeah. That's not what you signed up for.
So when I went to school, basically, and like was looking into like maybe going to like University of Nairobi for medicine, apparently they charge foreigners like more than double what they charge the local students. And that's not fair because I don't have that kind of money to pay double, you know what I mean?
Yeah, but it's Kenya. I mean, come on.
Yeah, but like I'm trying to be a doctor to help you and help Kenyans.
Oh, yeah. Okay, yeah. But there should be like a policy where like if you're going to practice like in Kenya,
we give you like a discount.
Yeah, like
exactly.
I'm sure even some countries have like certain policies that are close to that.
I'm sure they do. So they were like, oh, we're going to charge you like 1.something million shillings. And that's like a lot of money. Yeah. Because like the local students pay slightly less than $500,000.
Half
slightly less, so like 400.
Like 400?
Yeah, 475, 480.
For how long?
For a year.
For a year?
Yeah.
Okay, so that's
and then
that's $4,000.
Roughly, or 4,750.
Okay.
Yeah. So, and then you as a foreign student who's getting the exact same treatment, the exact same strikes, the exact same everything, you're paying like 1.something million. Is that fair though?
No, you'd rather just, if you have an option of going somewhere overseas,
cheaper, go somewhere cheaper.
And you can still come and practice it here, why not?
Exactly.
Why not?
Exactly. So I was like, you know what? Nobody has that kind of money. Let me like look to like other options. So then I realized that China was actually affordable, and it was good, and it was a 6-year course.
Wow.
Yeah. So I was like, okay, sure. Let me go China.
Yeah.
Try something new, see something new. Yeah.
How long is the normal course like in Kenya?
In Kenya, it's 6 years, but then when you include like the strikes and stuff,
you can actually do like 10. If I'm not
10, but like 7, 8.
No, but 8 is close to 10. Cause here's the thing, I'm guessing after you finish that, there's the whole thing of, is it training? You're sent into internship. You're sent to all these different places. Wouldn't it become close to?
It would, yeah. And then like 4 years if you want to like specialize. So before you know it, you're like 50.
Listen, no, but here's the thing. No, but we'll get to that because I was asking one of my friends like, yo, by the time like you're done with like the whole process and everything, and then you just start getting like that and equal that good amount doctor money.
Yeah.
Like, are you still young enough to actually enjoy that money, or now like you have that cash, it's now for your family and everybody else?
That's true. Yeah. So the thing is, in Kenya, first of all, people enter medicine for different reasons, if I'm being honest. The people who enter medicine for the money, the people who enter medicine for the satisfaction of like treating people, you know what I mean? And like kids and women.
Like you're actually passionate about,
So if you're in it for the money, then the public sector is definitely 1,000% not for you.
Not
because
for
the
you?
Public sector is not like you don't go to Kenyatta for money, because you're not going to get money. If you're working at Kenyatta, I don't think that the money is that well for you to be like, oh my god, like I'm like throwing money around, I'm like rich.
And how much work will you be doing?
Oh, you'll be doing a lot.
But experience, you'll definitely...
Yes. So if you're in it for like the passion and like the experience, then definitely public sector is definitely for you. You will learn, you will see different cases. Especially Kenyatta, there's like a lot of like referred cases. So you'll see a lot of like different cases with patients. So if you're in it for experience and learning and just like the passion of treating people, go to the public sector. If you're in it for the money, public sector is 1,000% not for you. So,
we'll
open like a clinic or something and make private money.
But that costs a lot of money as well. I think I've had friends who've tried to. They've opened them. But before we go to that, let's just take a step back and tell me just how the process was like, just learning this in China. Cause I'm guessing were you traveling a lot as a kid?
Yes, actually.
Oh, you were?
Yes, I was.
Oh shit, that throws me off with a lot of my questions. But I always have like a plan B.
No, we'll spin them around.
Okay, so where in which country did you like spend like most of your childhood?
Kenya, actually.
Kenya?
Yeah.
Okay, so then my questions is relevant. Yeah. Okay, so here's the thing. You're used to a certain race of people.
Yes.
How they talk and everything.
Yes.
How do you just adapt to that new environment? Plus this is medicine.
Yeah.
Like, do they study in English or?
Yes, they offer both. They offer Chinese and English. So then you choose the one you want.
Okay. So for foreign students you can still.
Yes.
But how was the experience? Because you're already used to Kenyans with striking and like all the things that come with like just the Kenyan environment. Mentally you're ready for that.
True,
how was it just studying and doing all this in China?
Okay, so first when I went to China, everything was different in terms of like development. Like they were really developed. Like the roads were good, the buildings were good, transport was A1.
Oh yeah.
Yeah, so that was different. But the one thing that I honestly did not like was the fact that they're not really used to black people, let alone black people.
Can you blame
with, like
them?
Scarves. That was like, that was like, yo.
Yeah.
So basically, they really do stare at you in public places.
They do how they touch like your skin. I've been
touch.
told that.
Yeah, they touch and
they touch before even asking.
Yes, they do 100%.
Be like kids do that thing where they
the kids even start crying when they see you. They're like, oh my god, what is this?
What?
Yeah, I've had kids cry when they see us black people.
Oh wow, they should see me. Well, I wonder how their reaction when they see me.
Yeah, and you know how African ladies, they have like their braids, like the extensions.
Yeah. So
we'll be on the bus with my friends, and then all of a sudden someone is touching her hair. Like, wow, what is this?
Yeah.
Like she's touching your hair with nobody.
Yeah, I hear the curiosity is so insane that they actually come and just touch and they're like wowed with even if it's skin, they just want to see if it's rubbing off. Yeah,
some of them have this mentality that if you're like of color, you're like dirty.
Yeah.
Like you got like this because of dirt. Like you don't scrub enough in the shower.
So if you take a proper shower.
I've had stories where people have gone swimming and the Chinese people get out of the swimming pool. Because they're like, Like, this is like dirt. Like,
no, but you also have to understand. And at times, you see, here's the thing. This person is actually not being directly offensive. It's they don't know.
Exactly.
They don't understand this.
Exactly.
Like, they're not like the only thing they know is their culture. And I hear they're super, super rich in their culture.
Yeah.
So you wouldn't blame them.
There was actually a friend of mine from here who asked, like, oh, like, how are you surviving in China? Aren't you like, fed up and offended all the time? And I'm like, listen, assuming us now in Kenya, like me and you now, okay, we're sitting here. Over there's like a guy who has like red skin. Wouldn't you be stunned, like, yo, what is this?
We have to call security.
Yeah, like, why is his skin red? That's exactly how it is for them.
But yeah,
they
I
don't see black people. The TV, like, they have no black.
Their channels, their movies, their music.
So imagine a kid who has come from like the rural areas, who has seen nothing but Chinese people.
It's hard.
Chinese people.
Yeah.
Then he's on the bus and he's seeing you in your black abaya, your black scarf, you're black, your skin is black. He's like, hey, what is this? And then he starts crying because he's never seen this before. This is like the monster. This is like the monster who lives under the bed. Like, why are you black? You know what I mean?
Yeah.
So
but
after,
did that get to you?
At first, yeah, it did. Like, it was really pissing me off. Like, why are you shocked that I'm like a person of color? Or why are you stunned that I'm wearing like a black abaya or like a black scarf? Like, you know. But then after like a few years or like a few months, you realize that it's really not their fault.
It's not.
They really are closed.
They
mentally.
don't know. They don't know.
They really don't know. It's true. Yeah. So at some point it does piss you off, but then you just get used to it, honestly.
Once
like
you start
on the bus, oh god, on the bus, you're on the bus and it's crowded and they're like Chinese people, and then literally, okay, like everyone like starts holding their nose. They feel like your perfume is like disturbing them. Does that make sense?
How? Do they put on
no things? Okay, they don't really use perfume.
Oh, they
sense.
don't?
Yeah.
Oh, they don't?
No.
Why?
I don't know. Like, they're like natural, you know.
Oh, they like the natural.
Yeah.
Oh, wow.
So if I'm on the bus and I have like my perfume going on and I'm like I'm smelling good.
Oh, it's
for them. It's like, no, like you can't be.
I can
like
just imagine the perfume, the way you look.
Yeah. So
the scarf. They're like, oh my, like, no, why? What is this? What's going on?
Yeah. And then there are those people who are really, really nice. Like, they come up to you and they're like, hi, where are you from?
Oh, they
like,
want to know. They really want to know about you.
Like, they're not really offensive, if that makes sense.
It's curiosity. Yes. It's just curiosity.
So they want to inquire more, like, where are you from? So some of them are good, some of them are offensive, but it's really not their fault.
Okay. But how come, now about, let's talk about the studying bit. Like, how is it, like, just taking the classes, and was it much easier? Did you do practicals?
Yes, we did.
So practicals means you have to engage like with Chinese patients, I'm guessing?
At some point, yes.
Yeah. So now I just want to know how that was like for you. Were you afraid of, like,
yes,
like giving somebody like bad treatment and be deported? Like, like what was going on in your head, and how was it like just, having that experience?
So at first, for the first 3 years, we didn't really do like hospital practicals. We did like practicals like on dogs.
Oh wow. Okay, now you see why. You see now why I'm afraid. I was right. Huh?
No.
So I should be afraid of you treating me.
No, but the thing is, at first you can't.
Is that how they do it? Use
like dead bodies and animals. I'm so sorry, guys, but this.
No. But that's okay. Here's the thing.
But we don't kill them though. We just treat them and then let them go. Like, we operate on dogs. But we don't kill the dogs.
Here's the thing. I'll just let it out there because we used to go with. We'll go back to your story, right? So I have like this doctor friend, and at times he used to go for seminars and stuff. And I was like, yo, bro, but this is back when I was like, I think in college, I guess, or back just starting off before I started like my internship in advertising and everything. So it was like, I have this seminar, there's a lot of food, you can, just come. Because basically I was going there for the food. There's no other reason. I wasn't going there for networking or anything.
Why else do you go for it?
Yeah. So like the friends would be like, yo, like meet the friends and everything. So I was like, yo, so what will I say that I do? So told me like, do this when we're there. You just say you're a vet.
Wow.
So like every time like, yo, this is my friend John. They're looking at my hair and then they're like, this is a doctor?
Yeah.
I'm like, I'm a vet. And they're like, oh, that's interesting. That's interesting. Okay. But they don't have any questions for me. So I'm like, safe for there.
Yeah.
But so just something that, reminded me of when you said, treating animals and everything. Yeah. But is that like the normal procedure they use there to, or is it like normal everywhere? Do they do that in Kenya?
In Kenya, I know that they use dead bodies. I don't know about the animals though.
Yeah.
But in China, we only use like stray animals. So we get like a stray dog. Maybe he needs like an operation. Okay, so they bring him to us. We give him anesthesia, guys. We don't just like cut into the dogs. We give him anesthesia, and then we do the procedure, and then we just stitch him up. Yeah.
Okay, next question.
Yeah.
I mean, were you ready for just dealing with, like dead bodies,
no, I was
animals
not.
And everything?
No.
Yeah, because I heard that a lot of, even students, some quit from that point.
Yes.
They're like, okay, I thought I want to be a doctor, but this is not for me.
For sure.
Yeah, so dealing with the blood, dealing with, just people in pain and suffering and all those. Like, how was that for you? How did you adapt to? Because you either have to be a psycho, either you're doing drugs, or because the normal people now, I respect, because even that's why, even I hear older doctors either smoke a lot, drink a lot, and all those things. But how did you
cope with it rather?
Because you seem like a very jovial person.
Oh, I am.
Yeah.
Okay, so basically, at first, I don't really mind blood as much, but I mind vomit. I can't stand vomit.
Yeah.
Like if you vomit, I'm vomiting with you. Like we're vomiting together. I can't stand the look or the smell of vomit. That's not for me.
Yeah.
But blood was fine. The dead body was kind of shocking, if I'm being honest.
Yeah.
Because it smelled funny. Like our eyes were watering because of the chemicals they used to preserve the dead body.
Yeah.
So it's like your nose is running, your eyes are running. It's a very uncomfortable situation, but you're there to learn, right? So at first it's very disturbing, to be honest. But then you do the thing for 6 weeks. So after some point you're like, you know what, this guy's dead. I can't kill him, can I? So
yeah. So but you get used to it.
Yeah. You do. You get used to the dead bodies.
But what was the initial the one thing that maybe that really scared you, maybe cutting and something spills
I was no. The first time we had the dead body, I think I was end of first year or beginning of second year. I was no, you know what, guys, you guys do this, me, I'm out.
You had second doubts.
Yeah, because then you learn the layers of the skin or the layers of the body rather.
I don't know them.
You peel the skin off the dead,
an
man.
Orange.
Yeah, you peel and then you observe the layers and then you peel the muscle. You observe
so now you're taught so that you can actually understand how.
Yes, the anatomy. Yeah. So how can I treat you if I don't know what I'm doing? And I can only know that by playing with, or rather, doing it with a dead body.
Plus, I also need to see some reassurance when you're treating me.
Yeah.
Because I can imagine if a doctor is treating you and then they're
yeah.
I don't want to hear that.
Yeah.
I really need to see your face, you're telling me, I got you. Just chill. I got you. Relax.
So how can you reach that point? Because you can't practice on, a living person, can you?
No,
you can't.
No, not really.
So you practice on dead bodies. We have people who donate dead bodies.
Oh yeah.
Rather than buying them or burning them, they donate it to science. So then you learn.
That's very interesting, and those are some of the things that don't come to play when maybe you're signing up for it, and then you're like, oh, I didn't think about this. This is a process that I actually need. This is the one bridge that I need to cross.
Yeah.
Okay, and then just what else would you say was just memorable from your college experience that actually made you say you know what, this is actually my calling and I actually want to do this? What's that one thing that
first of all, I really don't like seeing people in pain. That's not something I enjoy, or rather I don't think it's something anyone enjoys. So for me to be able to have that knowledge, to be able to relieve someone's pain or deliver a mom who's in labor, that's so satisfying. It gives me joy, if that makes sense. I'm happy when I see a kid coming crying that he's
Uh-huh.
vomiting, then you do your magic, or rather you do your medicine, and then the kid all of a sudden after 3-4 days
smiling, and you're
he's laughing.
It makes you actually feel good about what
it really does,
and gives your whole career a meaning.
It does, or you see a mom in labor, she's in so much pain, she's almost dying, okay, and then when you literally pull out the baby and give it to her, it's she's laughing. So where did the pain go? You know what I mean?
I don't know what you mean, but I'm just saying. I'm just saying. It's plus. I'm guessing every single day and that's the thing. A lot of people get bored with their jobs because maybe it's a routine thing that you're doing and everything. But I'm guessing with a doctor, if it's something you actually like, every single day it's all these different problems that you're providing like a solution for.
That's true.
And that makes it like more interesting and
That's
keeps
true.
you intrigued every single day.
Yeah, it's true. It's true.
But
100%.
do you think just practicing it to some point makes you get numb to some things?
Yes.
Really?
Yes, 100%.
And look at her. When she's saying that, she has like a smile on her face. She's like, yes. Oh, please explain.
Let me tell you. So,
yeah.
At first, when I was beginning off at Kenyatta last month,
yeah.
So currently I'm rotating at the obstetrics and gynecology ward, so delivering moms and CSs and all that stuff. So at first I was like, no, I'm not ready to see a lady in labor. That's not my thing. Like it's like I was feeling her pain.
Yeah.
Right?
She's screaming.
Yeah. So I was like it's like I used to empathize with her.
Yeah.
So, but the thing is, after you see like 3, 4, 5 moms delivering, you can't really feel bad for every single mom because that's not your job.
Yeah.
Your job is to literally get her out of that pain. You know what I mean? So at first it was really sad. I was like, no, you know what? Like I'm not gonna watch this because when some moms are delivering, like they actually tear, so I have to like stitch her up, and that's something else. So I was like, you know what? No.
Like tears, or what do you mean?
She tears up, like her where she's delivering from. She tears, like a tear.
Yeah. Okay.
You know?
No. I remember somebody giving me this discussion.
Or they cut her to like remove the child.
Oh my.
You know what I mean?
Yeah.
So then I was like, you know what? This might be me one day. Like I might be
so
on that bed giving birth.
I need to understand and be able to.
Yeah. So I used to feel her pain, but then I was told that you can't feel everyone's pain. That's not your job. If you feel everyone's pain, you're not going to be able to do your job. Yeah. So then I was like, you know what? You move on, you get used to it, and then after a while, it's like, you know what? It's fine. Mama Zatu.
So even when you get there and people are crying and then you just chill, you have
that's not your job. Can I go and cry with them? No. My job is to make them stop crying.
You just have that like face that assures them like you know
because if she's
it's
crying
just part of this.
and you're crying, who's doing the job?
You're making it even harder.
But if I'm
for
crying
her.
and I have like a doctor who's like confident with his job, like he's like, you know what, this is gonna end soon. Like I know what I'm doing. You're gonna feel some reassurance. You know what I mean?
Some reassurance.
Yeah.
Okay.
So you can't feel sorry for everyone.
True.
You do your job and you move on.
Okay, so at least now we know like just the whole process of how, we talked about how you can actually get numb to everything that's happening around you, people crying in pain and everything. Yeah. But let's talk about just the education system. Would you actually highly recommend, because it makes sense to me, would you recommend just people to actually go and study
in China?
In China? Or it's not something that you'd be...
It depends. Are you someone who's able to live away from home?
Yeah.
Are you someone who's financially capable of like sorting yourself out? Like you're given an allowance and that's supposed to fit you like the whole month or the whole 3 months, depending on the kind of... Yeah. So are you careless with money?
Yeah.
Are you... do you feel like you can live by yourself in a foreign land?
Yeah.
If yes, and you're able to like self-study, because China is a place where the teachers don't really speak fluent. Yeah, like they speak English, but like not really how it happens here in Kenya. You know what I mean? So you should be able to like get what they give you and then like self-study for yourself. Otherwise it's gonna fail and there's no point of going. So yeah.
Especially in a foreign country, and here you are like actually not paying attention to.
Yeah.
But was it easy for you? Would you say it was easy or?
Nothing in life is easy though.
But are you like a self-sufficient person? Because you're describing that.
Yes,
so I mean, to you can sit down, read a book, proper, do a breakdown and everything.
But for me the thing is like the whole semester. Yeah, like I'd be like in class learning and whatnot. But like when I hear like, oh guys, the exam timetable is out, you wouldn't see me. Like I'd be in my room or my house like studying because I know the exams are coming. You know what I mean?
Yeah.
And you can literally have like a good time like the whole semester. Like you do, like you go to classes, you also go out. But once exams are close, you have to sit down and like study because exams are everything.
They're everything.
Yeah.
Now, did your passion? Because now we're talking about like I've said, like even in the podcast, I just like to talk about all these different things. First of all, you know what the podcast is all about, right?
Yes.
What is it about?
This podcast or your podcast?
This podcast.
Medicine.
No. Okay, not this in particular. Like just the
podcast.
Yeah, my podcast.
People, different people. 4
pillars of life: health, wealth, love, and happiness.
Okay.
And all different people like have just different journeys when you throw a question in any of those.
That's true.
So basically, we'll touch on all of
Everything.
them.
No
Yeah,
problem,
we'll
sure.
touch. So I mean, if you're not comfortable answering
No,
something,
it's fine.
Oh, you're good.
I hope so. Throw the question. Let me see what it's about.
Okay. No, we'll get to what. When we get to that bridge, we'll cross it.
Yes.